Hello guys. This is Dr. Rizwan Mirza. Welcome to my channel at Dermatologist.
Hello guys. Although the season is over, we still continue to see larger number of our little enemies, mosquitoes. Today we discuss a very common health issue that most of our population usually have to face during the rainy season, that is dengue fever. Dengue is a viral infection, which is transmitted primarily through the bite of infected female Aedes mosquitoes, particularly Aedes aegypti. It is a significant public health concern, especially in rainy season, and is very common in many tropical and subtropical regions of the world. Dengue fever is caused by the dengue virus, which belongs to the Flaviviridae family. Symptoms usually appear 3 to 14 days after the bite from the mosquito. Severity of infection vary from mild to severe. Common symptoms that the patient presents with include high-grade fever, rapid breathing, nausea or vomiting, abdominal pain, severe headaches, generalized weakness and lethargy, pain behind the eyes, pain in joint or muscle, petechial rash, which is the red spots or erythematous rash that usually blanches on applying pressure, and bleeding can be observed in some cases, usually from nose and gums. In severe cases, virus can lead to severe bleeding by its variant, Dengue Hemorrhagic fever, and can lead to dengue shock syndrome, which can be life-threatening. Patient with any of the above symptoms should consult the doctor immediately. Diagnosis is confirmed by an antigen or an antibody testing. Antigen test, which is dengue NS1, detects virus in the early stages. Antibody test, which includes dengue IgM and IgG. Antibodies are detected once they are formed, usually 5 to 7 days after the onset of fever. Let's discuss the treatment. There is still no specific medicine to treat the virus, and symptomatic treatment, with maintaining good oral or intravenous hydration is the main forte of the treatment. Thus, patients are advised to drink plenty of fluid, and take paracetamol for fever and pain. Labs that are followed during the disease include white blood cell and platelet counts. Dengue virus affects bone marrow directly, leading to a decline in white cell and platelet counts. If patient is bleeding, or if white cell count and platelets are markedly low, patients are advised to seek hospitalization. During hospitalization, patient is well hydrated via intravenous fluids. If the patient is bleeding, injection are given to stop the bleeding. Injectable antiemetics are given in case of excessive nausea and vomiting. Injectable paracetamol is given for high-grade fever or severe pain. White cell count and platelets are followed on alternate or daily basis, depending on the symptoms, and in cases where downward trend is observed in the cell lines. If WBC is markedly low, patient is isolated, as patient is prone to catching other opportunistic infections, as their immune system is very low. Prevention is the best cure, and dengue can be prevented by eliminating the mosquito breeding sites. Since it's a mosquito of fresh water, cooling of water must be avoided, and containers and tanks must be covered properly to prevent mosquito growth. Other preventions that can help include using insect repellents, wearing long-sleeved clothing, and using bed nets. Prevention for patient with bleeding or low platelet count include 1. Avoid using drugs that can lower platelets, including antiplatelets, certain painkillers, like NSAIDs and COX-2 inhibitors. Certain antibiotics can lower the platelet count and should be avoided. 2. Avoid using toothbrush, use mouthwash instead. 3. Avoid using a comb. 4. Avoid using razor or blades. 5. Avoid scratching your skin with nails. 6. Avoid intramuscular injections. 7. Avoid using sharp objects. 8. Avoid any invasive procedures. 9. File your nails properly, to avoid breaking nails, leading to bleeding. It is important to keep yourself updated about the cases of dengue fever around you, so that you can start taking preventions early. If you have any questions or query, do leave us a comment.
Subscribe to my channel at YouTube at Dermatologist and press the bell icon for updated video. You can also follow my page at Facebook and follow me on Instagram. And if you like the video, don't forget to like and share the video.